HHS restricts care for immigrants. Health centers must act now. Imagine a world where healthcare is a privilege, not a right. Unfortunately, that's the harsh reality for many immigrants in the United States. The U.S. Department of Health and Human Services, HHS, has recently reclassified the health center program as a federal public benefit, effectively restricting access to essential healthcare services for non-qualified aliens. This drastic policy shift has left community health centers and federally qualified health centers, FQHCs, scrambling to comply with the new regulations, all while trying to maintain their mission of providing care to all patients, regardless of their ability to pay. But here's where it gets controversial. The HHS reinterpretation directly challenges the fundamental principle of health centers as safety net providers, forcing them to make difficult ethical and operational decisions that could have far-reaching consequences for the most vulnerable populations. And this is the part most people miss. The new policy is effective immediately, with no grace period for implementation, leaving health centers to navigate a complex web of federal eligibility rules, administrative burdens, and uncompensated care costs. So, what does this mean for health centers and the patients they serve? For starters, health centers must now verify the immigration status of patients seeking federally funded services, which could lead to a significant reduction in patient volume and revenue. The financial implications are staggering, with potential losses in Medicaid and sliding fee revenues, not to mention the added expenses of training staff, updating electronic health records, and implementing new eligibility screening processes. But what about the patients who will be affected by these changes? Non-qualified aliens, including undocumented immigrants, DACA recipients, and individuals with temporary protected status, will be ineligible for most services funded by Section 330 grants, unless they can provide documentation of their eligibility. This creates a service gap for those seeking routine primary care, behavioral health, dental care, or preventive screenings, unless these services are paid for through non-federal funding sources. So, what can health centers do to mitigate the negative impacts of this policy shift? Firstly, they must conduct a thorough audit of all services funded by federal grants to identify which services are subject to PRWRO restrictions. They must also establish standardized procedures for immigration status verification, while ensuring that patients are not wrongly denied care or fear immigration-related repercussions. Health centers should also explore alternative funding sources, such as state and local government programs, private philanthropy, and community grants, to support services for non-qualified aliens. But here's the thing. The clock is ticking. Health centers have only 30 days to submit comments to HHS, documenting anticipated harm and requesting program-specific exemptions or clarifications. They must also assess their legal exposure, monitor future guidance, and prepare for compliance audits. The stakes are high, and the consequences of non-compliance could be severe, including funding clawbacks, programmatic audits, and reputational harm. So, what do you think? Should health centers prioritize their mission of providing care to all patients, regardless of their ability to pay? Or should they comply with the new federal regulations, even if it means turning away ineligible patients? The debate is ongoing, and we want to hear from you. Share your thoughts, concerns, and questions in the comments below. As we navigate this complex and contentious issue, one thing is clear. The fate of healthcare for immigrant populations hangs in the balance. Will we prioritize compassion and inclusivity, or will we succumb to the pressures of politics and bureaucracy? The choice is ours, and the time to act is now.
Attorney General Bonta halts Trump policy. Head Start and public benefits protected until 2025.
Breaking victory. Coalition led by AG Bonta halts controversial immigration-based restrictions on essential public programs. Press release. Contact information: 916-210-6000. AG Press Office at doj.ca.gov. In a significant win for vulnerable communities, Trump administration barred from altering eligibility requirements based on immigration status until September 3, 2025. Oakland. California Attorney General Rob Bonta, alongside 20 fellow attorneys general, has successfully negotiated a crucial temporary agreement that blocks the Trump administration from implementing a series of agency notices that would have dramatically expanded restrictions on federal public benefit eligibility based on immigration status. This protective measure remains in effect until September 3rd, 2025. Just days prior, this powerful coalition launched legal action against the Trump administration for abruptly abandoning nearly 30 years of established federal practice. The long-standing approach had ensured universal access to certain public benefit programs, regardless of immigration status, programs specifically designated as protecting life and safety while enhancing community well-being. These vital services include Head Start early education, child care assistance for low-income families, adult educational opportunities, mental health and substance abuse treatment programs, and emergency shelters serving at-risk youth and survivors of domestic violence, among numerous others. The coalition continues its pursuit of a court injunction that would prevent the Trump administration from executing these changes throughout the entire duration of the legal proceedings. When the Trump administration suddenly reversed course on nearly 3 decades of federal policy that made these essential programs accessible to everyone, they created immediate turmoil for Head Start and other critical safety net services. Attorney General Bonta emphasized, today's agreement provides some breathing room for these indispensable programs, and more importantly, for the families who depend on them for survival and stability. California stands firm in our commitment to fight for continued access to these programs that are fundamental to the health and prosperity of our communities. But here's where it gets controversial. Should immigration status ever be a factor in determining access to basic human services designed to protect vulnerable populations? This agreement merely pauses implementation, leaving the fundamental question unresolved. And this is the part most people miss. These programs were specifically designated as exempt from immigration-based restrictions because they serve fundamental humanitarian purposes that benefit entire communities, not just individual recipients. The temporary agreement represents just the opening battle in what promises to be a prolonged legal fight over the boundaries of immigration enforcement and humanitarian obligations. Does protecting public safety sometimes require ensuring universal access to certain services regardless of documentation status? Or should immigration enforcement take precedence in all government programs? A complete copy of a stipulation document can be accessed through the Attorney General's website. What's your position on this issue? Should programs like Head Start and domestic violence shelters be available to all residents regardless of immigration status? Or do you believe stricter immigration-based eligibility requirements better serve our communities? Share your thoughts in the comments below.
Why banning undocumented kids from Head Start hurts our future. Expert insight. Here's a bold statement. Excluding undocumented children from Head Start isn't just a policy. It's a betrayal of our nation's values. But here's where it gets controversial. Is it fair to use the most vulnerable among us, babies and preschoolers, as pawns in a larger debate about immigration? Let's dive in. As someone who served as President Trump's Deputy Assistant Secretary for Early Childhood Development and Director of the Office of Head Start during his first term, I've witnessed firsthand the transformative power of this program. Under his leadership, Head Start became more efficient, maintained its commitment to quality, and even continued serving families during the unprecedented challenges of COVID-19. I was proud to be part of that effort. That's why I feel compelled to speak out against the recent interim rule that would bar children with uncertain immigration status from accessing Head Start. This issue is complex, but when it comes to our youngest children, those under 5, there are some fundamental truths we can't ignore. And this is the part most people miss. These children have no say in how they'd arrived here. They are innocent bystanders in a debate that's far bigger than them. Yet, they are among the most in need of our support. As long as they are in this country, the United States, a nation that prides itself on compassion and opportunity, should find a way to care for them. Let's break this down. First, the practical challenges are staggering. How would we even determine the immigration status of a 6-week-old baby or a 3-year-old? Are we expecting teachers to become immigration officers? What would that process look like, and who would bear the responsibility? If a child is found to be undocumented, what happens next? Do we turn them away from preschool? The real target here might be the parents, but the children are the ones who will suffer. Second, let's talk about the long-term consequences. Ignoring the needs of these young children isn't just cruel, it's short-sighted. Research tells us that 80% of brain development occurs by age 3 and 90% by age 5.
Head Start has a 60-year track record of success, helping over 40 million children grow into productive, healthy adults. Teachers, doctors, military personnel, and even members of Congress are living proof of its impact. By denying access to these children, we risk creating a cycle of dependency that will cost us far more in the future. Here's a thought-provoking question. Is the goal of this policy to use Head Start as a tool to target parents? If so, we need to reconsider. Children should never be used to solve adult problems. Head Start's mission is to give every child in this country the best possible start in life. Excluding anyone based on their immigration status undermines that mission and contradicts the values that make America great. Let's also address a common misconception. Families aren't crossing borders primarily to access preschool. The data simply doesn't support this claim. Head Start is about providing a foundation for success, and with more information, we can find solutions that strengthen both our immigration system and our nation's future. President Trump has shown courage in tackling tough issues. But with that courage comes the responsibility to ensure our solutions reflect the best of who we are. Denying basic support to children who are already here goes against the ideals of compassion and opportunity that define America. I'm confident that with a closer look, he can find a way forward that protects children while upholding our nation's values. Now, I want to hear from you. Do you think excluding undocumented children from Head Start is a fair policy? Or does it go against the principles of a nation that prides itself on caring for its most vulnerable? Let's keep the conversation going, because the future of these children and our nation depends on it.